All right, Lagos. It is 17 minutes gone past 5. You are tuned in to Smooth Health here on Smooth 98.1. My name is Joy Ureye. And on Smooth Health today, we're going to be talking about the power of exercise and physiotherapy. Some people just think, okay, all I need to do is just hit the gym and that's it. But what if there are other things you need to bear in mind or you need to, figure out even before hitting the gym? Or let's even get into, thinking about those who need physiotherapy. Yeah, certain people that actually need it but don't even want to think about it. Well, we'll be touching on all that this evening. And my guest joining me to shed more insight on this is none other than Dr. Abiola Ajayi. Yay! Good evening.
Live and direct.
Yes, live and direct. Glad to have you here with me. So Dr. Abiola Ajayi is the MD CEO of ROA Specialist Hospital. And it's a pleasure to have you here to expand on the knowledge we're going to be getting today. We are a very busy people in Nigeria. So let me give
Recording live on the radio. Sorry,
so
I have to
what
tell my
yeah,
staff are making so much noise.
oh my word. Yeah, the hospital can be a very busy place, so I can understand. Okay, so talking about exercise, a lot of us are usually stuck in traffic, so if it feels like where is actual time? But for people who are hustlers who are constantly on the move, what simple stretches can actually help with stiffness? And I say stiffness because by the time you have sat down always throughout, maybe your desk, from your desk, you're heading straight to your car and you're heading home. You're sitting for long hours in traffic, all that. By the time you get home, all you're just doing is removing your clothes, having a bath, and off to bed. There's no time in between to say, okay, I've had a few stretches here and there. But, but let's even start with the basics and talk about exercise. Why is it even important to exercise?
Yeah, I think we touched on it a little before, but sedentary lifestyle, meaning somebody that doesn't exercise, is one of the leading causes of morbidity, which is sickness, and mortality, which is death. And a
Mm,
lot of different diseases can be linked to sedentary lifestyle. You just described it. You wake up, you jump in your car, you go to work, you sit at your desk, you jump in your car again, and you go and lie in your bed. You've not done any physical activity. There was a
true.
study done in 2023 in Lagos here that the average Lagosian spends 2 to 4 hours in traffic a day. And that's just crazy. In the U.S., they noticed that 1/3 of those people that spend that much time in traffic. 1/3 of them will have either neck or low back pain at some point in the year. So it's very common. It's in the States, at least, it's the number one cause of morbidity related expenses. So low back pain, neck pain are the reason why people call off work or go to see a
True.
chiropractor or go to see a doctor is one of the most common symptoms. So it's something that if we do a little bit throughout the day, we can reduce it greatly.
Talking about exercise, doing even if it's stretching, whatever sort of exercise at all, it's the this one. See, there are days I have this crick in my neck, and I'm wondering, oh my days, why do I have this? It's not from the pillow. So I'm always thinking, okay, is it the way I sleep? But I'm not the only one who's also experienced this. There's certain people who, constantly overlooking their laptops, their computers. So they have this hunch constantly and they have those neck pains. Yeah, sometimes even the back pains. But what should we be doing to ease off all that pain?
Yeah, which one? You talking about the pain the crick in your neck when you wake up, or you just talk
Yes.
about it in general when we're sitting in our
Oh,
cars or sitting?
I think we should touch on the back, then get to the neck.
Okay. Well, they're all related to. Oh, that's what I was going to say. Is that
Okay,
your
okay,
your spinal cord, your spinal column goes from the base of your skull all the way down to your tailbone, which is
true.
called the coccyx. So, and they're all related. Your each vertebra is, which is the bones that are in your spine. They're
Mm,
connected by discs, and so you can have an issue in your neck that you will feel in your hands. You can have an issue in your back that you'll feel in your legs. So
right.
they're all connected. There are a couple of things people can do, whether they're at their desk or they're driving. Now, if you're driving, um, being driven is different than driving, right? If you have a driver, you can do most of these. If
Right,
you're
right.
driving, you want to do whatever, as long as it's not going to keep you off the road. And I've noticed something that when I'm in traffic and I'm driving myself, if I take my eye off the car in front of me or the road, sometimes my foot will want to come off the brake, the pressure.
Right,
Have you ever
right.
experienced that? The car will, and by the time I bring my attention back, I'm like, oh my God.
That
So you
reaction,
you want to
yes.
put, and
Constantly paying
I won't say
attention.
if it was me. I won't say if it was me or somebody else, but may have hit the car in front of me. A love tap is what we call it, love tap.
Ooh,
And
okay.
we saw that on the side of the road in Nigeria. But firmly on the brake, you can do things for neck mobility. So I think people can see, but for people that are not watching, you want to tilt your head to the side and hold it for 10 seconds. As far as you
Ah,
can, 10
okay.
seconds, 10 seconds. And then the shoulder on the opposite side, try and pull it down. So you're stretching this
Mm,
muscle in here, it's say, right? And then you want to
okay.
do it for the other side, 10 seconds. Then down to your chin, 10 seconds. Keep your eye on the road. Then back, 10 seconds. And you want to do eye on the road, and
It's important.
you want to do that rotation of 4 3 times. It
Okay.
works. 50% of people that complain of migraine or tension headaches, a lot of
Right.
that starts a lot of that starts in the neck and this muscle called the trapezius. That's the muscle we're stretching when we lean to the side. So
Okay.
let's go as far as you can, not painful, but stretch 10 seconds, 10 seconds forward and back.
Mm.
We're working our way down. The next one is shoulder rolls. So you're rolling your shoulder forward,
Ah.
10 times, right? As high as you can, as far as you can. Then you're rolling them back 10 times as high as you can. You're working out the same trapezius and some of your lats. They work. I want people to try these things before they think that it's not going to work. And you do
Mm.
10 to the front, 10 to the back. That counts as one set. Try and do 3 sets. These are things you can do while you're stuck in traffic, right? They're
Okay.
going to reduce your blood pressure, reduce your stiffness, reduce your pain, reduce your frustration, all of that.
I like the fact that you said
All of
reduce
that.
the frustration because just sitting in traffic can actually just make you want to lose your mind. But yes, anyhow and any way you can
Exercise.
get some exercise in, it's important. Mm. Okay. You did talk about a chiropractor. Some people don't realize or they don't even think there's any need for a chiropractor. Can you help us walk us through why that's even
Yeah,
important? Because naturally, the only thing you're thinking of is a
you know,
physiotherapist,
and
and only when you have problems. Yeah, go ahead, please.
honestly cannot. Oh, you have a question?
No, no, go ahead.
Can you hear me?
Yeah, I can hear
Oh,
you.
so I'm not here um advocating for chiropractors.
Okay.
I don't know them in Nigeria. And in the US, usually doctors like me are at odds with chiropractors. Well, medical space. We like
Interesting.
to use medical physio
Right.
and the issue, so I'm not bad, I'm saying the issue with them is sometimes they do these high speed movements, right? Where they're cracking a neck or cracking a back. It feels good right then, right? You
Okay.
get some relief, but we don't know the damage. It could be causing damage to the joint and not speed.
Oh.
maneuver. So that's why I prefer. Yeah, they can be damaged. You know, you see the stories, but a lot of the stories where people are paralyzed or temporarily paralyzed or permanently paralyzed by a poor. So if you're suffering from chronic back pain or
Mm-hmm.
chronic neck pain, I would see it my doctor first, my
Okay.
orthopedist first, do some physio before I
Okay.
now jump into chiropractors. And still, I would do that very, very carefully.
Uh,
There's a
uh,
lot
yeah. Okay. Go ahead, please. Go ahead, please.
lifestyle, how you sit, your chair.
Mm.
Yes. I'm even going to ask about your diet. How much sugar is in your diet? Sugar is the causes inflammation and thing. I'm
I'm
going to
guilty
ask
as
about so many
charged.
so many different. Don't Yeah, don't you can't ignore those. You can't ignore those things. So I'm going to look at all of that, and then I'm going to now test the range of motion. Actually, how
Okay.
far can they turn it? Everybody has different ranges of motion, so you want to stay within that range of motion and
Okay.
damaging. So, and then from there, we can now talk about physiotherapy and chiropractic
Mm. Okay.
things.
That is very important. I have a question. I have a funny but interesting question that's being shared here by
All right.
a listener. Um, this person wants to know, I'm not going to mention names, wants to know how true is it regarding the exercise in the other room? Because it's been stated that it's a good form of exercise. How true or false is this?
Okay, so it broke a little bit. How true or false is what about exercise?
Is the exercise in the other room?
Exercise.
In the other room,
Oh, in
behind
the other
closed
room?
doors. Yes.
Oh, okay. Okay. Now I understand.
Yes.
How
Mm,
is that considered exercise? Is that the question?
that is a question.
Okay. So that's a very good question. It depends on your activity level. So the average
Mm,
behavior for
okay.
average couples is 5.1 minutes. 5.1 minutes is not enough
Okay.
exercise, right? And when you exercise, you want to make sure that your heart rate goes up for 15 to 20 minutes to call it exercise. So if you're in the other room for just 5 minutes, I can't call that
It doesn't
proper
count.
exercise. But if you're in another room with your heart rate at 180, huffing and puffing for 20 minutes, then you can add it as a type of exercise to your list. I think that's I think that
Please,
answers the question.
please be sure to check your your blood pressure before you engage in certain
And
activities.
and
That's a caveat I will put there.
if anybody has trouble lasting in the other room, I have solutions for that. They should reach out to.
Okay. Well, we
It
will
can be
talk
it can be
about
done.
that. We will talk about that and so much more on the other side. We have a quick breather that we need to take. You can send in all your questions. Not to worry. Dr. Abiola Ajayi will share his details and then you can, ask him all the questions that you are shy to ask on air. Let's take a quick breather. Try. Is fluid health. Oh my goodness.
What do you guys use for internet? Yeah, I didn't
Um,
get you for a while. I was like, what is she talking about?
ah, so the other room was what was brought on by uh late President Buhari. So he was talking about his wife in the other room, and
Mm.
yeah, so that was where that slang the other room came from.
What did he say exactly? I don't remember that.
I know I can't even begin to recollect what exactly it was that he was talking about, but he said activities in the other room was where he wanted her to be and all that. And Mm.
Mm.
Interesting stuff.
I think we'll leave that there.
We'll leave that way it is. uh my listener was just trying to be you know, fun.
Yeah, I
But
like it.
I like where he's coming from. I like his thought process. Because some people take it to be the actual thing.
Mm-hmm.
I've had where people say things like that, oh, once you can do that for hours, that's exercise. And I'm like, how does that count as exercise? That's you killing yourself.
Probably not. Probably not. Because it's all about your heart rate, you know. If your heart rate is probably you want it to stay high for, 15, 20, 30 minutes. If you're doing that kind of work in the other room, I'm sure your partner is happy. Very happy. You
And
won't have
those
any problem with somebody cheating on you.
uh, that's not a guarantee, but you know
Not a guarantee. True.
what?
True.
I'm not even going to touch it.
It's not a guarantee. It's
Not a
not a
guarantee
guarantee.
at all. Oh
Especially
my
not these days.
oh goodness gracious. All right, let's get back in. All right. If you aren't behind the scenes, well, sorry, I can't help you. But today on Smooth Health, we're talking about the power of exercise and physiotherapy. And my guest that's joined me this evening is Dr. Abiola Ajayi. He's the MD CEO of ROA Specialist Hospital. And while we're talking about exercises, because it is good for you. However, everything is in moderation. Even the gym bros need to know that they need to take it easy. But I'm not the doctor here, and thankfully I have doctor to expand on that. And we spoke about stroke 2 weeks ago. How does physiotherapy actually help someone who's recovering from a stroke? I'd like to touch on that because I see most people just go to certain homes and they're just massaging away. I'm not even certain if they know what it is they're doing, but hey, I'm not the one in that space. I've never had someone in that space, but I'd like you to help us understand why they need to go to the right person to do the right thing.
Yeah, so talk specifically with stroke, right?
Right.
Yeah, so in for stroke recovery, one of the most powerful areas is physiotherapy, to be honest. So first you need to identify the cause of the stroke, whether it's high blood pressure, high blood sugar, or blood clot, deal with that. But
Mm-hmm.
then typically people that have strokes will lose function. Maybe they'll lose muscle strength. I've seen 5 people with stroke today alone lose muscle strength on one side, or they may lose ability to talk, or their speech may be have changed. Even I've seen personality disorders, and usually those areas of the brain that are damaged by a stroke, they may never wake up fully again. But there's something called neuroplasticity, where you can retrain other areas of the brain
Mm-hmm.
to work it, and that's what physio is all about.
Okay.
So physiotherapy works by retraining your brain
Okay.
to create new connections around those areas that were damaged by the stroke. So it can help increase strength, can help improve your movement. 60% of people that have stroke have problems with balance, especially if they have a stroke in the back of their brain called the cerebellum.
Okay.
And physio strengthens those muscles and can also help you improve your balance. A lot of times I see people having difficulty walking, either because of weakness or balance issues. Physio also helps retrain your brain. And what a lot of people don't consider at first is your independence. That person that had a stroke that now has
Mm,
debilitation was getting up to the bathroom and cooking their own food, and now they're dependent on a carer or dependent on a wheelchair. and physio can help turn those things around. The thing about physio is that the sooner you start it, the better, and the more targeted it is, the better. I see a lot of people saying they're doing physio and they're doing nonsense. Like today, now I create a physio guide. So if I have a physiotherapist, I would create a guide. This is the exercise I want you to do for the patient. 3 sets of this, 4 sets of that. I take it upon myself to make sure because you're
I see.
trying to accomplish something. So if the left leg is weak, we
Okay.
make the person use the left leg under supervision so that it reprograms the area of the brain that controls that leg. And eventually,
Right.
over time, you'll get your muscle strength back. The reason why people have weak muscles is because the nerve no longer stimulates the muscle. So we have to
Mm,
wake up the nerve before we can wake up the muscle. And you do it kind of in reverse order. So the type of physio you do a lot of time when I hear people doing physio is massage and some red lights
right.
and some heat, and that's lazy. There's nothing wrong with that for people that have muscle soreness and tiredness, but that's lazy. That's lazy physio. You need to be active. You need to move the joint through range of motion and really take it seriously. But overall, physiotherapy is essential to recovering from stroke. I don't see
Mm.
how you can. And there's different types of physio. There's speech physio, there's motor physio, there's behavioral physio. So, but it's essential. It's crucial. Once you've solved the medical problem, physio should be the next step.
Ah, okay. So, usually around this period, well, I don't know if but as the weather gets colder, you might say we're not in in those parts or in those climes, but somehow we have the old and the elderly also complaining within this period that they get to have pain in the knee and the joints. So for those who usually have such pains, arthritis and knee pains, maybe from previous injuries or things of that nature, what exercise is usually safest to get involved in if
And
they
you're
should
talking
be?
about especially older people with joint pain, right?
Yes.
And really anybody with joint pain can do some of these things. Number one, walking on level ground, right? And you want to
Okay.
walk as you know, walking can maintain cardiovascular health with heart health without damaging or hurting your joints. And when you want to walk at a brisk pace, not a stroll, but brisk enough where you're breathing heavily, you can feel your
Okay.
heart rate go up, and on a
Mm.
level surface, completely safe to do. Um, then one that I love, and I've been training my patients for the last year, chair body weight squats, chair squats. So you have a chair
Ah.
behind you. I think people
Hmm.
can see. You stand up and you just squat so your bump touches the chair and you're back up again. That counts as one. And you try and do that 10 times, take a minute break, do another 10 times, take a minute break, and do another 10 times. If you have to take a 2, 3 minute break in between, that's fine. You try
That's
and
fine.
get sets of 10 and 30. But just using your body weight to do squats alone, if you just did that 3 times, those 3 sets a day
Right.
for a few weeks, you would notice difference in your energy, your joints would feel better, your sleep would be better, so many things because your legs are your some of the largest muscles in your body. So by
Exactly.
stressing those, it increases blood flow, it increases heart health.
Right.
It is. I suffered from severe low back pain, so bad that in 2021 I was supposed to undergo back surgery, and I did
Oh.
not want to do back surgery at my tender age then. So I researched. I even got a degree in integrative medicine, which is how to, thank you, how to use nutrition, diet, exercise, lifestyle changes to address core problems. And to this day now, I don't consider low back pain one of my problems. I've never had surgery. I lost a lot of weight, and all of it, a
That I
lot of it
can
was some
testify
diet.
to.
You remember how fat I was.
No, we were
So
supple.
yeah, yeah, yeah.
Oh my word. All right, sorry.
I had to
Sorry
I
I'm
had to
distracting.
chairman. I looked like a chairman when I was only a CEO. So But when you first started exercise program, like I lift weights now, but when I started with chair squats. And that was all I could do. I could barely do 10 when I first started. My legs would hurt and be shaking. No problem. Do your 10. If you can only do five, do your five.
That's fine.
The next day, do your
Gotcha.
five. But yeah, after about 3, 4 days, when the soreness goes away, you're going to be able to do 6, 7, 8, 9, and you just keep working your way up to sets of 10. Makes a big
Mm.
difference. If you have any water, if you can get into a pool, that's great for joints. Because we were talking about
Oh.
exercise that's good for joints. So if you know how to swim, it's useful, very good. If you don't, you stay in the shallow end and
And
march
just use your legs.
and just use the water
Mm.
as resistance. It's good for your heart, gets your heart rate up, and also good for your joints and your body. A
Mm.
lot of people say they want to get a treadmill and start running. That's what I tell them. If you have joint pain, no, don't do that because each time your foot strikes, you send pain from
Ah.
your ankle, from your foot to your ankle to your knee to your lower back, and this just how the shock goes up. So if you're going to do something like that, elliptical is
Mm.
a better, the one that kind of your legs just swing. That's safe on the joints as opposed
Mm.
to a treadmill, which can be painful. And the last one, if you're seated down, just try and lift your knee, your foot, your leg off the ground. So raise your knee up as high as you can.
Yes, you can.
Hold it for 5 to 10 seconds. Drop it. Do the other one. So you just alternate. These are things you can do at your desk. You can do in the car if you're paying attention to traffic. You can do it. You can do it everywhere. And
Right.
for 3 weeks, then
Mm.
we'll have a different discussion.
Okay, so I want to quickly drop this one. This is a question from a listener, and
Okay.
she says, "I'm 4 months pregnant. I'm still trying to figure out what exercise to do." Hmm. I would naturally just say, you know what, you need to ask your doctor, but
Yeah. Well,
I have a doctor here with me though.
yeah, and I'll answer briefly. I'll say one thing in defense of most doctors. We don't do a lot of nutrition in medical school, and we don't do a lot of exercise in medical school. So all the things I'm telling you now in this show, I had to learn afterwards or
How
go
to?
and take courses. So you first want to make sure that your doctor said you're not a high risk pregnancy. You're not high risk for miscarriage, high risk for preterm contraction, preterm delivery, all those kind of things. But if you're a regular pregnancy, chair squats can work for you too. The seated leg raises can work for you. I wouldn't be doing jumping jacks, but the stretches that we mentioned, everything we've talked about today,
Right.
you can do while pregnant. 4 months pregnant, even yoga, which involves deep stretching.
Stretching.
You can go on YouTube and get beginners yoga,
Mhm.
and you don't need anything for that. Just sit on the floor or sit on your bed, and do it. And it makes a difference. It makes a big difference. Reduces pain, reduces the joint pain and all of that. It can even reduce blood pressure because the more you breathe, the lower your blood
You're
pressure. Yeah,
more
it's very,
anxious.
very true.
All right. Well, I want to say very big thank you for your time, Lagos. How time flies when you are having
I
conversations,
I
especially
know.
with Dr. Ajayi. I sometimes don't even know when the time was runs, but hey, that's where we have to call it a wrap today. And for anyone who wants to get more insights, because I've already seen some who've asked, how can they reach out to you? Social media handle that they can get across to you and get all the answers
Sure.
that.
We're on all major social medias. I'm pretty active. So I think from the last show, people have even sent questions, and I've been replying from all over the Abuja, Kano, everywhere, which is
Awesome, awesome.
interesting. But ROA, that's ROA Specialist Hospital. You see it on Facebook, Instagram, Twitter, and even YouTube. I have videos that talk. If you want to call, it's 0913 579 5108. 0913 579 5108. Our website is www.thetheroahospital.com. specialist.com. And like I said, social media is ROA Specialist Hospital. By the time you put, I spend a lot of money on Google. So by the time you put ROA Specialist Hospital in Google,
it just comes
you
out.
will find us. You will find us. You don't even need to put my name, but I'm Dr. Ajayi, and I'm out.
Thank you so much, Dr. Ajayi. I know you have a packed evening, so I shall let you go.
Back to surgery.
Not because I
Thank
want
you.
to, but because I have to.